This is a patient who is in the same age group, a healthy 82-year-old female, presents with a relatively excessive tooth display in repose. This is not a smiling picture, whereas this is. The smiling picture is not too bad. She has a normal tooth display, but her intraoral presentation is one of lack of posterior support in the maxilla, cuspid to cuspid, with an average of 3 to 4 millimeters of periodontal probing on each and every one of those teeth, and a 2+ mobility on most of them. The lower jaw is in better repair. So the upper jaw is what we're really going to concentrate on. She does wear occasionally, she doesn't like it, but she does wear occasionally her distal extension partial denture. And it's interesting to take a look at from worm's eye and see the excessive overjet in her bite. And what's happening there is she is flaring out the anterior saxtant, giving her this labial incompetence and the flaring of the premaxilla, as you see there. Her X-ray is consistent with lack of bone in zones 2 and 3. She has bone in the anterior saxtant, obviously, and you can see the long restoration. So she does have composite defect vertical bone loss. So our clinical findings are one of loss of posterior support, primary periodontal disease on the premaxillary teeth, secondary occlusal trauma of the premaxillary teeth. She has a slide of 2 millimeters at most, and she has tardive dyskinesia, and obviously, which has resulted in a labial incompetence. Just to clarify, tardive dyskinesia is kind of an unclear condition, but it's associated with some medications, and the hallmarks of it is a coordinated facial muscular contractions of the mouth, the tongue, and jaws, and the cheeks, very much simulating chewing. It can be in the lateral directions, and it can be in the vertical direction. And sudden tongue thrusts, and therefore explaining why she has this remodeling of her entire premaxillary denoalveolar complex. They also have, the severity of the condition is basically described as the frequency of this involuntary muscular activity. And obviously the tongue thrusting, which can be as much as 60 times per minute, is quite impressive, and probably that's what's going on with her. In interviewing her, she would not have much of this movement, but as you start talking to her, as she, I guess, talks or gets nervous or is concentrating, you can start seeing the movement in her face. The main concern of this case is the labial incompetence in my view, because I don't know where to put the implants unless we want to replicate this, which is not what we want to do. So in working with Lambert Stumple, who's the restorative fellow, and I talked to him, try to get some more of his diagnostic photographs he's taken, but one of the things that he did, and absolutely right, if you want to find the position of the proper position of the anterior teeth, a transitional denture would be very helpful. But what if the menu says immediate load, no transitional denture? What do you do then? Well, then you immediate load, and you use your artistic ability and your general dental background, your restorative background, to try to guess, as educated as possible, where those teeth positions would be. And one of the tricks that he did, which was interesting, was if you look very quickly, he photoshopped this anterior teeth, and he brought it into the occlusion that they should be with the lower teeth before they were pushed out of the way by the tongue thrusting habit. Therefore, if we can change the inclination of the teeth into a more vertical, proper position, then maybe we can correct the labial incompetence. And by moving the lip, to move the lip back, we have to move the crowns back. To move the crowns back, we have to move the implant back. We have to put the implant in the yellow trajectory as opposed to the red trajectory, which would be the following almost the position of the existing teeth if that was in the right position. So again, to summarize, to get the teeth and the lip back to where it needs to be, the implant, instead of being placed there, is going to have to be placed more palatal. Going to Bert's concern, where is the bone? Do we have enough